Hi everyone, I am going to demonstrate the Lentino method in a tangential carpal bridge in an original method. Patient can either be standing or sitting, and next place the dorsal surface of the hand and palm upward on the cassette. It should be the center dorsal aspect of carpals to the IR, and gently flex the wrist as far as patient can tolerate or up until hand and forearm form near 90 degree as possible. Angle the CR into 45 degree to the long axis of the forearm. Direct CR to a midpoint of the distal forearm about 4 cm or 1.5 inches proximal to the joint wrist. Next is we have the tangential carpal bridge in a modified method. Patient should be seated or standing. Next, elevate forearm with pillows. Wrist flicks at right angle to the forearm. IR should be in a vertical position against dorsal surface of the hand. Angles 45 degree caudad, entering 1.5 inches proximal wrist joint. Gaynor Hart method, carpal tunnel tangential projection. Patient should be seated at the end of the table, with wrist and hand in cassette and palm down or pronated. Aligned hand wrist with long axis of portion of the IR being exposed. Ask patient to hyperextend wrist or dorsiflex as far as possible by grasping the fingers with other hand and gently but firmly hyperextending the wrist until the long axis of the metacarpals and the fingers are as near vertical 90 degree to forearm as possible, without lifting the wrist and forearm from the cassette. Rotate entire hand and wrist about 10 degree internally toward radial side to prevent superimposition of pisiform and hamate. So this demonstration is to see fractures of hook of hamate, pisiform, and also trapezium. Marshall method, superior-inferior projection. Marshall method, placing 45 degree angle sponge under the palmar surface of the hand and elevates the wrist to place the carpal canal tangent to the central ray, tangential to the carpal canal at the level of the midpoint of the wrist. Angle toward the hand approximately 20 to 25 degrees from the long axis of the forearm. The use of the Marshall method is the one that could be alternative to the Gaynor Hart method or projection.